Case 36. A mother brings her 14-year-old to the pediatrician because the child has been experiencing flu-like symptoms and conjunctivitis for the past 3 days. The child is pale and febrile at 39.9 degrees centigrade or 102.7 degrees Fahrenheit, and his respiratory rate is 25 per minute. His buccal mucosa has multiple blue-gray spots, and he has a maculopapular rash. His mother states that the rash started on his face but has spread to his torso. The physician notes that the skin lesions blanch with pressure. The mother states that her son is usually healthy and has never needed any medications or vaccinations. What is the most likely diagnosis? This child has measles, one of the most transmissible viral infections. Measles is caused by an RNA virus that is a member of the genus Morbillivirus and the family Paramyxoviridae. Transmission occurs by respiratory droplets, and the incubation period is approximately 10 days. 2 of the patient's symptoms are typical of measles: Koplik spots and blanching rash with cephalocaudal spread. What should be considered in the differential diagnosis? Flu-like symptoms may also be caused by infection with rhinoviruses, parainfluenza or influenza, adenovirus, or respiratory syncytial virus. Common causes of rash include Mycoplasma pneumoniae, human herpes virus 6, rubella, Rocky Mountain spotted fever, scarlet fever, or drug reaction. However, none of these rashes have cephalocaudal spread and none feature Koplik spots. What are potential neurologic sequelae of this condition? Approximately 1 in 1,000 patients with measles develop encephalitis, which is rapidly fatal in 15% of cases and leads to permanent neurological damage in 25% of patients. Infection with Morbillivirus can trigger acute disseminating encephalomyelitis, an autoimmune attack on the central nervous system, which is lethal in up to 20% of cases. Survivors often suffer mental retardation and epilepsy approximately 7 to 10 years after measles infection. Subacute sclerosing panencephalitis may develop. This infection, although rare, is almost always fatal. What test can confirm the diagnosis? Anti-measles IgM is seen in patient serum approximately 48 hours after the onset of the rash. A mucosal biopsy may demonstrate Warthin Finkeldy cells, which are multinucleated giant cells with inclusion bodies in the nucleus and cytoplasm. What is the appropriate treatment for this condition? There is no treatment for active infection. Care is limited to supportive measures. Measles is a reportable disease, and the patient must be placed in isolation. If other children in the family have not received the measles, mumps, rubella vaccine or MMR, it is likely that they will develop measles, and this virus is highly transmissible.